We want to talk about the ultrasound machine. This ultrasound machine over here, all right, there are things here on the sides that unlock the ultrasound machine, okay, on both sides. This goes on just like this, okay. Here, the screen rotates out. The unit turns on in the back right here after it's plugged in. Okay, then these bars here will start to show the warm-up component to the ultrasound machine. It takes about 5 minutes to do so. While it's warming up, okay, you want to check on your supplies. You need to make sure that you have enough ultrasound gel. You need to also make sure that in the back you're untangled, all right? Your power cord has a tendency to get tangled up with your ultrasound head. This is the ultrasound head, okay? You want to make sure that it is in a locked position, which is all the way to the right, versus an unlocked position, okay? You want to make sure that your ultrasound head does not have any cracks or splits in it or any previous gel on it. After you've had a chance to check everything, you should be now at the point where you see this on your screen. Okay, you have multiple facets that you can take ultrasounds of, all right? We're going to use the musculoskeletal kinetics, okay, that's what MSK stands for. Using this mouse here, excuse me, using this mouse here, okay, you rotate it to here. If you look at your keyboard, on your keyboard, you have multiple things here, okay? So once you've identified that there, all you have to do is press set, and your unit will come up, okay? Now, the way that an ultrasound unit works is that it reads exactly what it's reading from the head into the body part, all right? So the body, so what you're reading from is the top of the screen down this way. So you have to think about what you're seeing here, all right? At that point, jelly goes right on the head. Now, you just need about that much jelly, okay? Not too much, not too little, just the right amount, all right? And you can see already you're seeing an ultrasound image, all right? The body part, when you put it on a body part, all right, you move the jelly around so the jelly actually encompasses the whole head of the unit itself. Okay, if you leave a portion, see that on my hand, if you leave a portion of the ultrasound off, as you'll see on the screen, okay, that ultrasound component won't pick up and it comes in black. Okay, so you're seeing it from the skin. This is the skin, and this is moving into the body part. All right, soft tissue shows up as a gray component. All right, and the higher the density, you'll get a different ultrasonic wave that'll bounce off of it. For example, if you see a scar, all right, you'll see a hard fibrous area. If you see a scar, it'll come across as a white line as you're going down through. So you're thinking, if you see a white line that goes like this, that's an area of a scar that you've actually run across. The best way to actually interpret an ultrasound is to actually move the head around. Okay, and you can move it in different planes to get different images. All right, so you can see how it's better in a dynamic component. The more the head fits on the body part, the less noise is picked up by the ultrasound. All right, so when it hangs over this way, all right, that outside part actually is noise, and you're seeing it as black. All right, the ultrasound unit does not know how to interpret that. Now, another thing that's going to turn out to be black is going to be bones. Bones are going to show up as black because it's a hard density component here. All right, so you can see that I'm right here. I'm on a muscle belly here. That's pretty much all. That's muscle tissue, adipose tissue. When I move it this way, okay, now I'm moving towards my thumb, and you see how my bones of my thumb are starting to come into play here. Okay, so I move it back, and the muscle. So I can see the muscle attaching right to the bone there from this point. Okay, see that white line? That's just an area of strain. That's not a true, and you'll see scar issues or scar tissue that'll come out as a little bit more of a white line. Okay, there's a lot bit more intricacies that are involved with ultrasound, but that's the basics. That's what we're looking for. We're looking for black pockets, which are an indication of blood pooling. Okay, indications of ganglions that'll form. Okay, so you have to interpret. You have to understand the anatomy and interpret what it's doing there from that point. Okay, all right. So once you're finished, okay, you'll wipe your head off with wipe your body part off. All right, you wipe your head off with a paper towel, and then also a little bit of an alcohol swab. Okay, after you finish that wiping with an alcohol swab, okay, you also want to put a little bit, just a little bit of like some emollient, such as lachydrin or something there. It's just like a skin, like you're treating your skin, because this will get dry after a while. Ultrasound gel will dry it out. Okay, you want to take a picture of the image. Okay, take a picture of the image, so the image then can be uploaded onto the patient's chart. If you're doing multiple pictures, all right, what you want to do is go to the exam aspect right here and press exam. You're back to this screen again. You've already gotten your picture. You need to make sure you got your picture before you move, because if now whatever you had on your screen is lost if you didn't save it. You press your exam and you go through the same process again. You go to musculoskeletal, okay, and you go to set, and you're back for a fresh new exam ready to begin. Okay, turn the machine off. Okay, after you've gotten your picture, okay, and you've cleaned off your head, okay. The only way, unfortunately, to turn this particular machine off is to go to the off and on button in the back. Make sure that you have everything together before you turn the unit off.